University of South Carolina upstate student. This is my patient. She is a 24-year-old female, and she has a significant history of diabetes insipidus, lupus, and bone cancer. We're just gonna do a quick head-to-toe assessment on her. So I'm gonna start with her head. I see that she wears glasses. Do you wear glasses for nearsighted or farsighted?
Both.
Both? Okay. So I see that she wears glasses, and I'm just gonna go ahead and take a look at her head. So I'm gonna palpate her head, and at the same time, I'm taking a look at her hair, whether her hair looks brittle or shiny. She has pretty healthy hair. And while I'm palpating her scalp, I'm also looking at her actual scalp. And I can see a scar here, and I'm gonna follow the scar and see to the extent to where it extends down. So you can turn your head. And the scar starts from her forehead, and it goes down to the front of her ear. What kind of surgery have you had there?
I had a tumor on the right side of my skull. They had to remove it and replace it with a platelet.
Okay, so it seems like her scar is related to her past history of bone cancer. So I'm gonna keep palpating. Do you feel any pain?
No.
Okay. So at the same time, she does have a history of lupus, and I'm taking a look at her face, and she has rosy cheeks. Are your rosy cheeks something that's always happening to you?
Yeah, it's just my rash. It's just one of my symptoms that is always visible.
Okay. So, and I'm also noticing her mouth when she speaks. Can you go ahead and open your mouth for me? Okay, and just right out off the bat, I can notice that she has some thrush going on. Do you know that you have thrush or patches in your mouth?
I do.
Are you getting a prescription for that?
Yes, I get this little cream. I don't know the name. And I do use Orajel mouthwash, which helps relieve the pain and stuff.
Okay. So it's are you receiving any medications like a chemotherapy?
I am. I'm getting Benlysta infusions once a month.
Okay. So it's most likely due to her chemotherapies. I'm gonna go ahead and have you follow this pen only with your eyes, okay? Okay, and while I'm up here, I'm going ahead and I'm looking at her cranial nerves. I'm gonna ask her to smile. Can you go ahead and smile for me? Can you frown? Can you puff up your cheeks? Okay, so I'm gonna go ahead and I'm gonna push up against your jaw. I want you to open your mouth. All right, so she has a semi-decent strength. Did that hurt? Okay, I apologize. All right. So I'm gonna take a look at her ears, and they look clear. And I'm just gonna take a look at her eyes. So I want you to open your eyes. Okay, good. Okay, good. And then at the same time, I like to ask them, have you been feeling dizzy or nauseous?
No.
Okay, good. And then I'm just gonna take a quick listen to her lung sounds while I'm up here. Take some deep breaths for me. Actually, I'm gonna do the back of it since she's sitting down. Okay, take some deep breaths for me. Have you been having any cough?
Usually in the morning I wake up with a little cough, but
I'm gonna push down on your shoulders and try to push up for me. All right, very good. So while I'm here, more preferably it would be a gown, but on my patient, I do know that she has a scar right here. Ooh, where is your scar? That she has a scar here from a past central line, and that's also very significant in her history. So I'm gonna go ahead and palpate her abdomen. Let me know if you have any pain. Okay, so I'll palpate around the abdomen. She has a soft, non-distended abdomen, and she's not complaining of any pain upon palpation. I'm also going to go ahead and take a listen to her abdomen. Now, since she has long sleeves, I'm just going to ask her to pull her long sleeves up. You're going to take a look at the integrity of her skin. And we see a bruise here. I'm not able to check her capillary refill due to her nails. But while I'm here, I can see the bed of her now, and I can go ahead and press down on it. She has very good capillary refills. So, how are your periods?
They're really irregular.
Irregular?
Sometimes they come, sometimes they don't.
Okay, all right. And then while I'm here, ideally, if she was my patient laying down, I would go ahead and check her bottom as well. But this is overall an active 24-year-old. Do you have any open cuts or sores right now?
No,
Okay.
other than my tongue, no.
Okay, so while I'm down here making my way down to her feet, I'm gonna take a look at her legs, and immediately we can see that her legs are full of bruises. Do you fall a lot?
No.
Okay, so ideally we'd like to know the origin of her bruises. Sometimes bruises in the elderly can indicate falls, and it's important to know a patient's fall risk. So I'm going to go ahead and come down here to her feet. I'm just going to remove her feet, remove her shoe. And again, she has nail polish on her feet, so I am unable to check her capillary refills. But I can go to her toe and see that she has good refill there. I'm going to check her pedal pulses. And she has strong pedal pulses. We're going to go ahead and check both feet. Okay, very good. And then I'm going to go back up here and check her radial pulse. Okay, and she has very strong radial pulses. And that's going to complete my quick head-to-toe assessment on a patient.